You're there? Great. Thank you for being there. Let me have a short introduction. Let me introduce you very quickly. So you're Vincent Dupont, if I correctly pronounce your first name.
Yes, perfect.
So it's a French way to pronounce it. And then you're founder and manager partner of DHS.
Yes.
You worked for 10 years at Microsoft, but you also did a lot of more than just working at Microsoft. And you was later involved as a strategic advisor in different in different digitalization projects for private as well as for public organizations. You will talk about the untapped market of health, focusing on digital technologies enable changes in the healthcare industry and the growing role of digital giants in that industry. It's great to have you here today, Vincent. Thank you for sharing your thoughts with us. The floor is yours.
Thank you very much. I'll share first of all my screen to all of you in order to make sure that everyone can see the deck that I'm presenting. So just quick check if this is working already.
This is working, I see it. Go ahead.
Yeah, perfect. I'm going to put it in full screen modus. So anyhow, I wanted to thank the Surrey Business School, yourself, Wim, and many attendees to this webinar, because I enjoyed really the first presentation from Dr. Erik Ranschart about AI, because there is a couple of points which will allow me, of course, to zoom in on the things I wanted to share with you. And of course, it's if you look, ecosystems has been shared widely in a couple of questions. And I think it's a good moment and therefore to put two things in perspective. Certainly, if you look, I'm nearly 25 years now in the health market. I'm very passionate about it because, of course, I was spoiled to travel a lot around the world in meeting health partners and health customers, and looking to, on the one side, what's on the agenda, the untapped market of health, and where is the patient in the ecosystem, because don't forget, the patient in that part has an important role, and which I will navigate into my presentation about important things you'll need to understand. And of course, a little bit a flashback to me for 2012. I was going to HIMSS 2012, which is the largest health IT conference in the world. Just imagine 37 people from everywhere in the world that look to what's on the agenda and where is the technology heading. And where I was in one of the side events where we were looking on the discussion about when that digital transformation is happening, what's going to be the role of the general practitioner or the doctor. And I'm a little bit heading to the presentation of Eric, and I think that there is an important remark that Eric mentioned also in his presentation about AI, is that you will see not only the doctor, the general practitioner, his role evolving, but also about the radiologist, his role is evolving, because let's not forget about the whole therapeutic discussion between, on the one hand, the patient, and on the other hand, his GP or specialist. Yes, there will be certainly a need to look in how to look to AI data, but let's be sure, I would rather prefer that the radiologists help me to better understand and look to the data than taking some conclusions myself, because first of all, we are not trained for that. I'm an economist by formation. My passion is in healthcare, but let's make sure that we look to where the specialists are and they can help us in that area. And of course, a little bit fast forward to 2000 and I would say 2014. This was the headlines of the Time magazine on the 11th of September 2014, where at that moment, Apple Watch was launching a new wearable that would change your life. And that was a little bit the headline, if you would like it or not. But what I wanted to say here, and which is a little bit the backbone in my whole presentation, in where we go into the next 20 minutes, is that this is where it's starting for all us together on a worldwide basis. Because I would say, if you look to that wearable that now is making the connection to where we are heading right now to connected care, this is a fantastic moment. I just wanted to share to the whole audience. And of course, when you're talking about connected care, and this is just an example from the 9th May of 2019, when the Tan Tock Seng Hospital in Singapore was launching his new operations command center. Just imagine a little bit like a virtual hospital that has a control room and really looks to how is it capable for looking to optimize and look to efficiency, because let's not forget we are in a market where quality is the most important driver where we're looking for. But where it comes on efficiency, and again, coming back on the previous presentation from Dr. Erik Ranchard, he shared a lot about interaction with workflows. You just hear that there is still a lot of work that can be done in that area. So on that part, I would say this is something that you will see that's going to be very important, because if I just speak for my own country, being a Belgian citizen, is that we had in the past more than 100 hospitals. We are being now concentrated into 25 networks, hospital networks, where sooner or later there's going to be a virtual hospitals that will allow people to be followed outside the walls of a hospital, because that's the future. And when you talk about that Apple Watch that we saw, we talked about the wearables and connected care. So this is a thing that I would say is rather soon than later coming ahead of us. And of course, this is about the untapped market, because of course you would have a good idea about when I'm talking about an untapped market, what does it mean? And let's say if you look to the ecosystem builders that I'm going to share with you, it's of course a huge market. If you look at it from a, I would say, a more spent perspective, it's a $4 trillion market. So it's really a huge market. And there are some interesting numbers, and I'm not going to share them all of them, but I would say which makes it very interesting to look to where is there certainly an interest. Let's not forget really at the left corner side, that security breaches are very important. And we all saw during the COVID-19 pandemic that a lot of hospitals were affected, and that laboratories also were affected in our countries, and that this is a weak I would say a weak place where there's some attention that is needed. And of course, we all do know that the worldwide population is getting older. We all know that there is a shortage on the healthcare market. And of course, we have to deal in looking to how the digital part can, let's say, help us in that part. And of course, when you talk about digital, there is something that I wanted to share with you, is that we're talking about FIRE, and it's really how I'm pronouncing it right now. It's really about the new kind of semantic interoperability standards that today is going to be used for, let's say, making sure that we can just exchange data much more easily when it comes to, as I mentioned, the future of the health data exchange. And why is FIRE important to mention? Because on what I will share a little bit with you on the big ecosystem players, and again, it's not because I'm not mentioning Siemens or Philips that they don't have a pivotal role, but when you look to FAMHA, which I will explain later, it's about some important drivers that we will see that will change the market, because when those big tech giants are putting their efforts to look to that market, it means that there's going to be generated much more exchange of data and allowing us to connect those kind of wearables, or as Eric mentioned, those CE level 1 kind of certified medical health apps that today are already being used. So this is an important part that I wanted to share with all of you. And of course, why now FAMHA in healthcare? And you could just argue whatever, it's Facebook, Apple, or Facebook, Amazon, but these five, I would say, these 5 big tech giants make it really important to look to today. Why are they looking to that untapped market? It's number one question you have to look. And secondly, what's gonna change and what's the opportunity? And this is really something interesting to look ahead of where we are right now. And of course, as already mentioned, on the trends that are providing those opportunity, tech companies, a lot of, let's say, a lot of white spaces or compelling events is, yes, of course, the shifting demographics that are happening. Of course, as Eric mentioned in this AI presentation about, really an explosion on the healthcare data point of view, changing healthcare buyers that you see. And of course, let's not forget, either not only the administrative burden that is still happening right now, but also we are in a market where there is a lot of waste. And let's face the reality is that this is going to be one of the things that will have to change in most countries that have today this on their plate from a health point of view. And of course, let's not forget, why do I talk about FAMGA? Is that, of course, when you look to those 5 big tech giants, to their installed base, yeah, it really looks to, let's say, why are they looking to this kind of untapped market, and why do they still see opportunities? Because I would say that, and I take just maybe the first one is that, yeah, Facebook today has a 1.6 billion active daily user instance that they put ahead of it, and they might be maybe on compared to the 4 other ones, maybe the one that entered late into the game, but they are the one that they have the user base to become a kind of healthcare front door. But of course, let's not forget is that they still face a big issue when it comes to what we call trust issues linear. And maybe just to share a little bit some recent information, I think it was published somewhere last week. There was a data breach of 533 million data records from people that are on Facebook. Of course, Belgium is in it. I think that when you can confirm, I think only Belgium had 3 million affected data breaches. I think the Netherlands had 5 million data breaches. So it will, unless they still work or try to do better things on their privacy, I think that's going to be one of the players that will have, compared to the 5 other ones, I think most difficulties to know if you look on people that don't trust them really on the personal information or where they want to go for your personal health record. And of course, if you look then to the second one, I would say Amazon today has, of course, the infrastructure, because they were really capable. If you look on the retail industry in which they've built it, and underneath the AWS, so their whole infrastructure from a cloud perspective to build that, is that this is, I would say, kind of runner-up. That, and if you look then to the recent acquisition they did a couple of years ago with PillPack, and you have to ask yourself, why by the heck should an Amazon buy a company which is, let's say, completely different to what Amazon is doing? But I would say, if you see now on that slide, this is really about the inside story, is that Amazon is looking to that prescription market and thought, hey, listen, this is a 500 billion, and it's only talking on US numbers, because I'm only sharing a little bit on the acquisition that Amazon, but it gives you a little bit of perspective on where the market is today and what's the reason they are going underneath. Because when they took that acquisition, is that they see enough margin to enter into that game, and it's a big number. So, and if you look to how efficient they work from a supply chain point of view, you could not neglect them, and it's one of the companies that certainly is entering into in that game where they see enough, 1, volume, and 2, enough margin into entering into that game. And of course, then if you look to the third one in the game, what is Microsoft putting in perspective is that they have today still one of the most popular workplaces apps. And if you look to the Office 365 places today that they have in mind, they have quite a big installed base in which they can work. And of course, it's not because I used to work for Microsoft, just to be clear on that part, because I do work with all except with Facebook on that part yet today, is that they're still seen as one of the most trusted tech companies in what they do. And of course, they learned into some failures, because it took some time to look to that they built everywhere some data centers in order to get that data sovereignty that is playing an important role. But anyhow, it's a company that had the workspace with the whole collaboration suite. But of course, one of their really growing engines is about Azure. And I would say in that cloud space, it's really about a head-to-head Amazon and a Microsoft that are really growing very, very hard in that market. and are making evidence on it. And of course, if you look then to I would say the last one, and looking of course to Google's DNA, it's clear that Google started as a really strong search engine, and allowed them really to try to differentiate themselves. And certainly, and I come to the next point of where Eric presented it in his presentation, is about they're really, as a tech giant, taking the lead in AI research, because it's a company that, of course, it's part of their DNA in where they had that experience in doing a thing in it. And of course, it's where they have the possibility to go to other initiatives, because I didn't mention it, but you see Google it in eye disease area on diabetic retinopathy. You see them in cancer areas, so for breast cancers, where they're doing some research. And of course, you see them also in some typical chronic diseases like hypertension, diabetes, where you see them. So it little bit give you some flavor. And if you look to that from big tech giants to where do you have to see them, and where are they trying to differentiate themselves? And the fact that I'm mentioning it in when Wim was reaching down to me is about, yeah, if you look to really ecosystem players, these are really ecosystem players, because you can't really neglect them about how they are going to that market. And as one of the last things here that I wanted to mention on the Google part is that you see now, and this is of course, you know, every hospital has an EMR system, electronic medical record system, is that, yeah, they're trying to navigate and interact and making that bridge in order to making that visible, not only to the patient, but making it understandable to the patient. Because don't forget that this is an area why in the beginning of my presentation, I was talking about those ecosystems, but I was talking about the importance of the patient, because at the end, it's the patient that today wants to have the best advice, best quality on the kind of treatment he has, and where it's important that therefore we look to interact with the patient. Not only because GDPR has been launched to it, because as Eric mentioned it in his presentation, it's today also that we have to deal with it, because you have to look in order to look to treat data and to make sure about how can you get an informed consent from the patient in order to work for that. And of course, when then you look to, as I mentioned in my third or fourth slide about Apple, you see also a big player which has premium products at a premium price entering to a game where they want to differentiate themselves. They are, let's say, evolving with their smartwatches, and where they really look to kind of applications that will allow them to go to the wearables and to the home the home care. So this is, I think, also an interesting one that I did want to share. And of course, at the end, it's not only looking to those ecosystem players, to where are we coming from, but it's about, if you would say to me, what is the biggest trend and maybe the biggest priority, not only from a healthcare, but from a life science and pharma market, they're all really competing for one thing. They're all competing for the patient experience and getting the best AX or patient experience or onboarding they can get on that. And as you see, of course, it's linked to what we say an important informed consumers breakthrough. Why? Because with an informed consent, patients are not only giving the right to distribute their health data with other healthcare professionals, but it's also about when you work with those wearables, going to connected care, is about really how are you dealing with the patient with it, and how are you dealing it from a, I would say, self-management point of view. And this is where in the primary care, we see an important role that is happening in now, in where trainings will be important, because let's not forget is that when you go digital, you will not solve all the world, because there are still people that are not digitally connected, and you will have a way in where you will see a big digital part, and you will see some still hybrid mode of care that is happening, because this is the world. And I would say this is something where we need to take into account that these people need to get the best treatment, the best care, and of course need to be interacted with. And of course, on the right side, the important patient, I think what is really important, in where I would say put a red circle on it, is about, this is of course also important. We have to teach and make sure that the patient gets the right information and is looking to authentic sources where they find the right information. Because let's be honest, when you look to prostate cancer, you look on the Dr. Google, it's not, let's say, the best things you might see, because it's really unfiltered information you have on that part. So, and why I'm telling that is it's not only about the technology, it's not about, let's say, in the transformation for going to digital, about changing processes, but it's also about the people, about how will you make sure that you train your people, not only from the care provider, but how are you interacting and making the therapeutic relation with your patient very strong? Because at the end, I think this is where everyone is looking to get that that best quality level from what he's bringing to the patient. And finally, because I didn't share them within the big companies, but anyhow, I would say this is a tremendous slide that I like from Philips, because I would say Philips is also a big ecosystem player that have proven with a long history, and even now more, because they are really divesting a lot of other industry and really focusing hard on that market. About how they say that, about, yeah, we all live in a kind of health continuum. About, yeah, how are we looking to more only when we were used to work on the cure parts, looking now to the steps before, about how can we interact in getting people to live healthier, and look on the prevention. Because I think this is really the holy grail where every healthcare provider is looking for, is about how can we make sure about, in the things I mentioned about that connected care, can we early enough detect things that can happen and interact with. And therefore, this is something that I like very much, because we come in the healthcare market from what I called a kind of integrated care. How will patients be followed? And I was participating to a big hospital network on an, let's say, on a first strategic direction in how he will stay 2 days later on. How can we make sure that he could get a good treatment, and that there is a follow-up happening to the specialist in the hospital. And why is this important? Why is this example very important? Because the financing systems as they are currently are not adapted to that. Certainly, if I look to our own country, Belgium, let's say doctors, specialists, hospitals are paid by treatment. And let's say, of course, the more treatments you do, the better you live and earn some money. But this is not, let's say, going to where you have to go to value-based healthcare. And therefore, I would say that this is, of course, with the current pandemic situation that we have, a tremendous opportunity, because everyone knows that how it's mostly currently working now, it needs to change. And as I'm mentioning here in one of my two latest slides, is about this, what was Frost and Sullivan a couple of years projected that would happen in 2025. I do believe it's even closer. 2022 or 2023, we will really go to see these kind of things happening right now, because technology is not really any issue anymore. I would say that the biggest part right now is making sure about how can we empower those patients and onboard them, looking to where it's needed, the self-management they need, the attention, the time, the empathy. So it's really about getting a kind of equal level patient-doctor relationship that will be important. So the cooperation between technology and healthcare is not enough on its own. It's therefore an example that I wanted to stress that, yeah, technology is very good, but at the end you have to look on how can you deal with the patient with it. So this comes to an end of my presentation. I do want to thank Wim and the Surrey Business School and the attendees for joining us, and of course looking forward to your questions.
Thank you, Vincent. Can you stop sharing your screen so that
yes,
we
yeah, I will
go in a kind of discussion mode?
Yeah. Okay.
You're still sharing the screen.
Okay, now you will have probably my screen back.
Yeah, that's perfect.
Yeah.
Very nice. So let me ask you one question. It's obvious that the 5 or even more digital giants will get introduced or will generate, let's say, new services in the medical industry. So my question is, what does that mean for the other existing partners there, like the big companies, Philips, Siemens, IBM, or let's say the hospitals, primary care, or the small high-tech startups? What does that mean for them? Is that a kind of, will this be kind of a competition? Will this be a competition? Will this be a collaborative game? How should I see that?
Well, first of all, it's a good question, Wim. It's I would say more. It will be a collaborative market because let's not underestimate that. And this is why I shared on my slide the discussion about this semantic interoperability need about FHIR, because FHIR is just an extension of HL7 that used to be the standard. But why I'm telling you is that it's the first time that the big techs are putting their shoulders underneath, and that would accelerate that kind of the usage of standards. Yeah, because let's face it, my own country, Belgium, was using not even the FHIR standards. Netherlands was using it. The UK, Australia, the US was using it, and they are the former, let's say, countries that started with FHIR. And recently, Belgium as a country is following FHIR also and this is important because I give you one simple example. When I'm going to travel, even going to Spain, I have an accident. I'm not even capable showing my antecedents, my allergies to my GP. So it's really important that we look to how can we make sure that the portability of data can happen and much faster, because at the end, this is still a big problem. And therefore, I would say this is an opportunity for hospital providers, for software builders, for those big ecosystem players. And the reason for just naming them is because they're taking it seriously, because it's a $4 trillion market spent, and that's numbers that they're looking for.
Yeah. So, Ijeoma, I think there's a number of questions coming from the audience. Is that correct?
Yes, please.
Go ahead.
The first question is from Rudy Martens. She's thanking you, Vincent, for this presentation. It has a very positive message. And her question is, how much time can doctors spend in consulting the different databases worldwide, having meetings with specialists abroad with all kinds of different databases, time, money, health improvements? How can they keep the balance between the different variables? Because time is limited.
Yeah, very good question, because I would say that first of all, I support physicians, specialists and doctors that they get still the time in where they're trained and the best for is doing their job. What they really need now is, I think they need more intuitive and better tools where they are capable of getting updates. Because on the other hand, one thing I've learned is that when just a general practitioner is finishing school, they always say he has a delay of 7 years when it comes to things he misses for working. And I'm not only talking about digital health tools, because I think that every country has to look to add in the curriculum to how can we add digital tools or digital health tools in it. So therefore, I like very much the question, because I think that we really need, I would say, the industry needs to think about giving tools that allow doctors to take better decisions. And therefore, Rudy had mentioned a very good question, that when there is, for instance, for a certain pathology, a question, that he can easily get it and he doesn't lose too much time on it, because the time is limited. And therefore, I do believe that they lose too much time with administrative things, which is not efficient at all. And that is why I say sometimes the word efficiency, because I do still believe there's a lot of work in that. And on the other hand, when I was talking about the patient, we really have to look at it from a patient point of view, because the patient needs to understand it. And therefore, the role of the specialist is always needed, because he will guide him into what it means and what he has to do for it. Therefore, I would say this is, a big go-do that the industry has to go much deeper in getting much better intuitive tools, allowing specialists to do their work.
Okay.
We have another one from Anne-Leen De Coninck. Her question is, as usual, we see a lot of US companies in this field. Glad to see Philips as well.
Yes.
Any ideas on how Europe could become more relevant, especially considering our different business and societal models for healthcare?
Well, I liked it, because let me face it, I'm also a European citizen first, and I think therefore I do support many initiatives, and I think therefore we have to collaborate much more. And I just result on something that has been announced recently, is that I think we have to join forces on what the European Commission has just launched with the new program of Horizon 2021. When 95.6 billion funding will be released, not only on health, but on let's say on digital and on the Green Deal, but where we can do much better, but we have to collaborate much more together. Because if you look to the Gaia X example, which is an example that showed in Europe trying to take forces in the cloud space towards the big US companies, Merkel on the German part and Macron on the French part launched that initiatives, but we are not agile enough. I would say we need to speed up initiatives. So therefore, it's good to fail, but fail fast. That's what I would say in terms of how we have to look forward, because honestly, we have all the experience here. You don't have to go to the US for doing it. The only advantage is US is one liberal 250 million market, and that's where, of course, it's a little bit the dynamics that are different.
Okay, we have another one from Lena Haddad. Her question is, do you think that in the future, precision medicine, functional medicine, and multi-layered patients' data will contribute to a prevention solution, counting on multiple data sources at the same time, not providing big pharmaceuticals with revenue from treatments at late stages? Will prevention going to be a point on the horizon and medication and treatments in the back stages?
Good question. And first of all, I would say on all the kind of subset of that question, I would say yes, absolutely. Why? Because if you look on not only precision medicine, but from a different angle, you see new players looking to even precision, let's say precision food, and looking to where can we on certain diseases and pathologies, making sure that we can get better food on that. And just to give you an idea, Wim, the Colruyt Group is heavily investing in that part. So I would say precision medicine and certainly precision food will boom up. You might see new players entering into the game, because as I showed that example from Philips into the continuum of care, the holy grail is really about the ones that we're looking into with the data they have. Yeah, looking to how can they interact early enough for making sure that we get a better lifestyle.
Okay, we have another one from Samir Chinag, sorry. His question is, with the epidemic COVID-19, is an opportunity for healthcare marketers to humanize their communication strategies. Currently, a lot of online persons prefer to buy from companies that show how they are protecting customers against the threat of COVID-19. The question is, what does any communication coming from a healthcare brand online need? Okay. And he's thanking you for the great presentation.
Well, welcome. I would say it's always a pleasure, and I wanted in those 20 minutes, because we can talk 1 hour first of all about that big issue. Wim knows that, but anyhow, coming back on the question is that I think just on the first hand validation, because of course COVID has showed one thing, is that it took too much time for allowing teleconsult to be used. Because it's already in most countries 5-6 years. You saw some pilot projects showing easily why a patient couldn't be treated through a teleconsult line or communication. Because if I look and back to the example in Belgium, COVID came through, so we faced the pandemic, and suddenly all the GPs wouldn't have any income anymore. So what happened? We have an instance called Medicomuts, and this is the associations of the primary care general practitioners and the health payers that come together with the national body RISIF in Belgium to discuss about new nomenclature numbers that can happen. Suddenly, on a 3 days basis, it was decided. And why? Because the general practitioners wouldn't have any income anymore. So I would say sometimes it's also about a little bit political reasons. That, and you know, in politics there is no logic, and therefore it's true. You can laugh about it, but it's important to know that I think people have to look to validate make sure that their solution is validated. They have someone from a big organization or hospital is using it, because I do hope that one thing is happening, that we will embrace more and more those technologies, because I think it will stay, because honestly, it showed really that there is plenty of room to increase that efficiency when it's come to workflow, when it comes to data, when it's coming really about trying to give better feedback to the patient. I would say there are plenty of examples, certainly where the big companies are not thinking to it. So therefore, when you talk about the opportunity for other players, there are, I would certainly stress out that many niche players have certainly their role to play, because I don't believe in the one size fits all. I saw Agfa in the past trying to make a monolithic application, and it didn't work, because I don't believe that it will work. And everyone has tried to crack that code, but it's not working. So that's why it's a little bit a particular market, but where it's don't get me wrong, I'm since 1996 in that market, but it's the less optimized market if you compare to retail, to manufacturing, and to finance. It doesn't mean that it's not quality, because quality is the main driver in the healthcare, but it means that there is still a lot of room for improvement.
Sure, I fully agree with that one. Ijeoma, let's move on. I think there are more questions, right?
Yes. Alexandra Komai is thanking you for this. And also his question is that he's based in Japan, and he's wondering how well Japan is developed already in accepting this digital transformation in healthcare.
Well, thanks for heading up the question. I would say Japan is doing very good, because they are, and I think it's not a surprise for most people in the call here today, they are also one of the nations that have the most elderly people in their country. So, and why I'm taking them as an example is they're not by accident the nation that started the Six Sigma production quality label, and therefore it's in their genes of the Japanese people. Therefore, you see a couple of examples. Japan, I was talking about Singapore, because Singapore is a small country, but when it comes to innovation, they are really the benchmark. Believe me, it's not the US you have to look, because in the US, you have 3-4 big instances like Kaiser Permanente, the Mayo Clinic, and a couple of other ones that are really the leading edge, but the rest is underneath the average of what you could find in Europe. So therefore, I think Japan is a good example. You have good ones in Australia too, and of course I come back to, for me, Singapore, because they're really the country that thinks from that control room kind of view in let's say treating better their patients and trying to do more on the preventive part.
Okay, we have another question from Jamila Zimamanova. Her question is digitalization connected with additional income for hospitals, or rather economic savings? And thank you also for your response.
Well, when it comes to economic savings, I think it's first of all underneath, it's one of the most important questions in an let's face the reality, we are all, most European countries, in public funded healthcare, comparing to let's say where the US is more, let's say, a private paid with Medicare, Medicaid kind of market, is that of course they are financed through governments, through the taxes we have, but you see that most of these hospitals, they change their I would say leadership, and where the again, this is I think a good advice that I see and think happening in the market is they bring people from outside the healthcare markets in, and that is why I mentioned to Wim the example of optimization in manufacturing, in finance, and in retail. You happiness. They bring that, let's say, optimization and efficiency kind of experience into the organization. It doesn't mean that they put all the doctors aside, but that they really look even with the budget they have to make savings. Because I do know a lot of hospitals that have investment budgets to do great innovative things. And I think therefore this is a good part where of course you need leaders, and therefore I would say those hospitals need to have a vision, need to have a strategy. And of course, you see these ones, of course, investing and testing new things, because it's possible. Because I would say, yeah, we used to have a lot of hospitals that made a lot of debts, and every year the government had to put a lot of money on it. But it was also to a lack of leadership, let's be honest, because leadership means also about when you have a big budget, you run a hospital of 2,000 employees or 8,000 employees, you need to make sure that, even like Eric Ranschart was mentioning in the AR part, the role of his radiologist will change, because at the end he will have tools that will not replace him, but will allow him to get better decisions, to take decisions upon it. So therefore, I would say that I'm very optimistic when it comes to that part, because you see change happening, and of course that's one thing. And of course, you see young people coming into hospitals that are used to work with digital tools. So this helps also a lot in where you see that, yeah, they want that change, because they used monolithic or old legacy systems which are not really user friendly, and where I would say this is first of all a good consequence we see.
Very good.
Okay.
Ijeoma, I will take the second last question, and you can take the last question, right? So the second last question is something that triggers me. It looks like a dilemma, but I'm not sure if it is. So on the one hand, you see that these large digital giants, that they are less trusted by people. You showed some evidence there.
Yeah.
At the same time, they are champions in customer-centric services. If you look at Amazon, if you look at Facebook, they are really the champions in customer-centric thinking. On the other hand, you see that companies like Philips, because probably of their long-term relationship with hospitals and so on, are really trusted companies in the medical area. But they are not really customer-centric in the sense that we see a Facebook or that we see an Amazon. So is there a possibility to combine both? Is there a possibility to improve things by combining the skills and the competences of both types of companies? Question mark, right? So it's a wide question.
Well, I will say definitely yes, Wim, and why? You will see that these kind of organizations, because I shared Philips, I didn't mention a lot about Siemens, I didn't share a lot about GE, because let's not forget GE is also a big player that has relevant experience and is doing great things in that market. What I see happening, Wim, is for sure that they will attract talent coming from those companies and trying to reshifting their approach to be a little bit more customer centric, because they are well trusted.
Yeah.
They have a long customer base, and in what they do, they are reliable. Because let's not forget, if you see all those ECG and echo machines and MRI, they are very good machine and solid, because they have to be good in what people pay a lot of money for in hospitals. But this is what I might see happening, is that they're sooner or later going to have to change, because this is why, of course, these companies enter into that market. Because if you took that example of Amazon, and I remember, because I used to work for a big pharmacist organization, which is a national body in our country. And yeah, they were really afraid that Amazon was entering into the game. But I was saying, hey, listen, these guys see an opportunity in what is only targeted in the US. Just you can imagine that they see, one, a big market, two, efficiency gains that can be done. Therefore, it's a kind of wake-up call, Wim, that these companies have to reinvent themselves. And this is, I think, a very good initiative in where companies will have to reinvent, because that is where big companies might fail soon, because they are in an old tradition way where they think it can't happen to us, even the big pharma, because I can tell you, the pharma has to reinvent themselves because they are making pills, but now their big battle is really to gain the trust of the patient. Yeah. And everyone is betting very hard on that. I had, by accident, I knew the people from My Sugar, which was an app for diabetes. It was a kind of diary book for diabetes. I was not so surprised that 3-4 years ago, it was bought by Roche, a big pharmaceutical company, because I met those guys in Austria 6-7 years ago, and they had a fantastic application. And therefore, you might see these dynamics happening in where these big companies will buy those kind of companies that have really that intuitive part that they miss. So either they're going to hire the people, or they're going to buy those companies, so which makes it very attractive.
You see that in major pharmaceutical companies, right? So
yeah.
Yeah. Ijeoma, your last question.
Thank you so much. This question is from Terence Stefano. The question is, Microsoft has established a sort of monopoly with Office 365. Wouldn't it be better to similarly have a monopoly too in digital healthcare, instead of regional and national systems that cannot communicate with each other, so that patients and doctors can rely on a global platform using the same system? A unique clinical cartel that can be used across each hospital, for example. Of course, this may kill the innovation. We would like to hear your thoughts on this.
Well, I would say it's, don't get me wrong, it's a very noble question, in the fact that it would make life easier. But if I look only for Europe, 27 member states, and therefore coming back to what I mentioned, FHIR, that will be the first step to exchange health data. We're not there yet. And we're not there yet because we also face in our 27 member states, 19 or 21 or 22 different languages even. So it's something we have to face. So therefore, yeah, it's a good idea. It's a bold dream, but I don't believe in it, because the only let's look on Europe on finance point of view is that we agreed on one currency, and this was the best thing that happened for a European citizen. But looking toward one national record, and don't get me wrong, I used to be in the government last 4 years working on a big patient project for the Ministry of Health. I can tell you it's a bold dream, but it's unrealistic, and it's not even depending on me. Let's be honest on that, but it's difficult because, as in many things, is then when it comes to these kind of decisions, you have too many cooks at the table. And that's kind of expression that I wanted to say. That let's say everything on that, on Terence, and I found it a very good question from Terence.
Yeah, Terence, so thank you very much for this question. He was one of my students in the NUS in Singapore.
Okay, that's fantastic.
But I have to finish it here because we are going over time. So thank you very much, Vincent, for this nice presentation and this inspiring discussion that we had with many interesting questions, but even more interesting answers. We know that we're not going to solve anything here, but it's good to bring it to the surface and see what the problems and the opportunities are in healthcare and digitalization of healthcare. So thank you again very much.
Thank you very much.
Before I end this session, I want to introduce the next session, which is the April 29th. We start at 3 o'clock London time, not 2 o'clock London time, because we have a speaker coming from California, and so he has to get out of bed before he can speak to us. And his name is Tim Dawkins, and he is working for the World Economic Forum, and he will talk about digitalization and ecosystem building in driverless cars and trucks. So in let's say driverless mobility. So we switch from industry, but then the second speaker, we take it back to Belgium, we take it back to medical care, is Dries Hens from Linkscare.
Linkscare, yeah.
And he will talk about natural language processing and the use of the benefits you can generate from unstructured data and the kind of revolution it may generate into the healthcare industry. So we are continuing. Keep in mind, it's not only April 29th, we also have another one May 20th, June 10th, and July the 1st. So I'm gonna prepare all this, I'm organizing all these webinars. I'm almost finished with all 4 of them, all the remaining 4 of them. Probably you will get an email as soon as they are ready, so that you can block your agenda and see who the speakers will be at that time. But in any case, you will get next week, you will get an invitation for the webinar of April 29th. So together with Tim Dawkins and Dries Hens. Thank you for your attention. Thank you for being here. Thank you for remaining till the end. And hopefully we see each other the 29th of April. Bye-bye.
Thank you very much.
Thank you very much. Have a good time.